Okay, here's another subject up for debate. It's been in several debates from several different groups. Um, Basically, I want to put my position out there is I'm a right to life person. Um, when you have a close relationship with God and you start understanding the life force that you see coming from little small babies and children playing, and they can be two or three of them sitting there playing, and it's almost like you can see this life force glow that comes from them. It's like a spiritual glow that comes from them. And of course, in the Bible, there's many references to the Spirit. And I hope you can respect my position on this. There's endocrine systems, there's circulatory systems, there's nervous systems, there's skeletal, muscular systems. However, um, they do not explain the spiritual system. So let me put this out there and say I do support right to life, and hope people can respect that. Now, one thing I can clarify for you if you're on the fence, there's a man with a Japanese name, I can't think of his name right now. He's done some research about harvesting stem cells from the umbilical cord. And what he did is he had a chart and graphs and a pretty intricate setup, and he explained in one part about concentrations of stem cells, and in this other part, there's stem cells in the amniotic fluid, there's stem cells in the placenta and after birth, there's stem cells in the umbilical cord. And one thing I do remember about that was he figured out a way to tie off the umbilical cord at birth where they could harvest the blood out of the umbilical cord. Evidently there's a certain procedure that must be undertaken, and when they do it that specific way, they can get a higher concentration of stem cells. And that's a good thing, because that doesn't cross over the moral issues of artificial insemination and growing embryos specifically for stem cell research, which I cannot support that morally in my heart. And so what this research does do, as well as some other research, it does make it apparent that we can use the stem cells that are already present in the amniotic fluid, in the placenta, and harvest the stem cells out of the umbilical cord properly. OBGYNs could learn the specific procedure which increases the probability of getting a higher concentration and capturing the blood from the umbilical cord, which has the higher concentration of stem cells. And then we could use those for research to help people with like spinal cord injuries, like Parkinson patients like Michael J. Fox. We could actually fuse there's a very intricate spinal cord has a very intricate series of nerves. I have seen research where nerves have actually grown to take on these stem cells have actually grown into a nerve to take on functions of damaged tissue that was there. However, sometimes the networking, the wiring is so complex, it's hard for them to take all of them on. It's happened in mice. It may be a matter of time to help out humans. So we can see the moral issue here, just capturing the ones that are already existing, not growing one specifically for that and hurting embryos, which is a bad thing. And this also raises the question, I heard a big debate about Octomom, and I'm sure what people need to understand, when people do artificial insemination, it's my understanding that sometimes it takes more embryos to increase the chance of fertilization and them attaching and being born. So, however, in her case, she had a history of having children. Maybe the person doing the procedure should not have done 8 embryos if she was quite capable and not a high-risk person, not a high-risk patient here. maybe he could have just implanted 2 or 3, and she wouldn't have felt morally obligated to implant all 8, because there would have not been 8 to begin with. So as you can see, once there were that many, it was probably her feelings to have them all implanted, which I can respect that decision, because she knows that they were there and they were alive. And however, if I want to consider other people's points of view, one thing they may have looked at was the fact that she was quite capable of having children, and possibly, I'm not saying this for sure, I don't know all the details about her health history, but possibly the person doing the procedure could have implanted, could have grown less to begin with and implanted less, which, you know, the total number would have been less and everything would have been fine. So other than that, I hope I've actually urged the president myself. I know this right to life and right to choice is a big issue. We need to increase education about children, about abstinence, finding the right partner. Therefore, there won't be all these unborn children. Young women need to understand that young men aren't always focused on being a family and being a father. There's people, things, children, women, girls, boys go through. There's maturity levels. It's very intricate. So keep that in mind. That person you're having risky behavior with may not be there tomorrow, so be very careful. Also, I want there to be no misunderstanding here. I was raised from a single mother, so I know that I support women's right to choose on a number of issues, like I support their right to equal pay, their right to define their relationship in a marriage, and so I'm not just out there, you know, talking off the wall. I do support women's freedoms, and I do it all the time in many ways. And their right to define their relationship within a marriage. People have different personalities. They have different roles they play in marriages, and I'm not stepping on those roles. And that's between the man and the woman in the marriage, and the woman has every right to have her rights in that. I mean, there's spiritual issues there. When a man and woman get married, they're supposed to be committed to each other. I know sometimes there's personalities can conflict, but they can find ways to overcome that, define their roles, and move forward. So I hope this helps some of you that might have been on the fence on the right to life issue, and I hope the recent Supreme Court nominees, as well as those in power, consider these ideas. And thank you very much for watching this. I hope I helped define this better for you and make it more apparent as to some ways to handle decisions on this matter. Thank you for watching.